Hello, I'm Dr. Sharif El-Nahal, and I'm honored to serve veterans, families, caregivers, and survivors as Undersecretary for Health at the Department of Veterans Affairs. 2 years ago, on August 10, 2022, President Biden signed the PACT Act into law, arguably the most impactful veterans legislation in recent history. Military service can often result in health risks that manifest years after active duty. The PACT Act is fueling the largest expansion of veteran health care and benefits in generations, particularly for veterans with toxic exposure-related health conditions. On this 2-year anniversary, I am proud to report that the success of the PACT Act was far greater than we anticipated, and we are just getting started. The responses from the VSOs have been amazing. Captain Leroy Torres, co-founder of the Burn Pits 360, says the PACT Act is the blueprint of President Lincoln's promise to care for those who have served. Allison Jaslow, Chief Executive Officer of Iraq and Afghanistan Veterans of America, declares, quote, "Bottom line, the PACT Act and VA's prioritization of its implementation continue to be a huge win for the post-9/11 generation and all generations of America's veterans." And Daniel Seehafer, the National Commander with the American Legion, says, "The American Legion is proud to have advocated for this monumental legislation and grateful for its enactment." On March 5th, years ahead of the timeline outlined in the PACT Act, we further expanded VA healthcare to millions of veterans by establishing 3 new groups of veterans now eligible for VA care, including veterans who are exposed to toxins or other military hazards during their service, veterans who are assigned to certain duty stations in Southwest Asia or parts of Africa, and veterans who deployed in support of certain operations after 9/11. All veterans who meet the basic service and discharge requirements and were exposed to toxins and other hazards while serving our country, at home or abroad, are now able to enroll directly in VA healthcare without first applying for VA benefits. And even if you never deployed but were exposed to toxins or hazards while training or serving on active duty, you can enroll too. We want to bring as many veterans as possible into our care because VA is proven to be the best, most affordable health care for veterans. To do that, VA has gone above and beyond to ensure veterans are aware of these changes and the benefits that they may be eligible for. We've held more than 2,600 PACT Act-related events since 2022 and have hundreds more scheduled this year. To date, these efforts have resulted in the screening of 5.6 million veterans for toxic exposures, with nearly 2.5 million veterans reporting at least one potential exposure. This means that millions of veterans and their care teams now understand the potential health risks that they face and paths to better preventative care. 740,000 veterans have enrolled in VA healthcare over the past 2 years, a 33% increase over the previous 2-year period. VA is also seeing record numbers of claim submissions. As of the end of June of 2024, VA has processed more than 1.4 million claims and granted 75% of them, which is nearly 1.1 million claims, directly resulting in the award of $6.8 billion in earned PACT Act benefits to veterans and their survivors. The PACT Act also provided new avenues for critical research that is helping VA better understand the effects of toxic exposures on overall health at a population level. We are conducting a scientific review of possible new presumptions for leukemias and multiple myeloma. And we're working with other federal agencies to establish a clearinghouse website for federally funded environmental exposure research, as mandated by the PACT Act. VA is committed to do everything we can to reduce the burden our veterans often face when trying to access VA care and benefits. And the PACT Act has opened the door for us to do just that. If you are a veteran, your claim is more likely to be granted today than at any time in recent history. So please don't walk, run to apply for the VA health care and the benefits that you have earned. I want to thank President Biden, Congress, veteran service organizations, veterans and their families, and our dedicated VA workforce for your support. We can be proud of what we have accomplished together in 2 short years. Having said that, there is a lot of work to do to realize the full potential of the PACT Act, and VA remains committed to getting it done. Now, submitting a claim and gaining benefits is easier than ever. All you need to do is visit va.gov/PACT or you can call VA's information hotline anytime at 1-800-698-2411. Also, spread the word. Do you have friends who are veterans, family members, neighbors? Make sure the veterans in your life know to visit va.gov/PACT today, so they too can get the care and benefits that they've earned. I want to thank you for your time, and most importantly to our veterans, service members, and their families. Thank you for your service and sacrifice to the nation.